Hello all, welcome to Care Samvaad with me Mirchi Hemant and I have Dr. Chaitanya Challa with me. Sir, welcome to the show.
Thank you, Hemant. We've been talking for quite a while now, and
Yes.
it's nice to be here. Finally.
The face to the voice.
Thank you, appreciate it.
సార్ ఫస్ట్ క్వశ్చన్స్ అసలు నాకు ఈ మధ్యకాలంలో యంగ్స్టర్స్ లో కూడా డయాబెటీస్ అంటే వాట్ ఈస్ దిస్ అన్న ఫీలింగ్ వస్తుంది. ఏంటి సార్ ఈ డయాబెటీస్ చిన్న యంగ్స్టర్స్ లో రావడం ఏంటండి, టీనేజర్స్ లో రావడం ఏంటండి?
And basically, Hemant, what is diabetes is the primary question.
కరెక్ట్.
Diabetes is nothing but increase in your blood sugar. So if that blood sugar, when is checked, fasting blood sugar from the vein, not capillary, fasting blood sugar from the vein, it should be less than 100.
రైట్.
That means you're eating right. Whatever you're able to eat, insulin is released to keep it below 100. You're normal. When that system fails, means you're not eating right. So you're putting more sugar in your body, eventually in your blood. Or the insulin is not able to work well enough to reduce that insulin to that sugar level to less than 100. Or a failure of both. You're not eating right, insulin is not working right, or both of these have failed. Then the sugar rises. When it rises above 126 and above, it is diabetes. So in between 100 to 126, 100 is normal, 126 or more is diabetes. What's in between? Impaired sugar. Means you are at high risk of definitely developing diabetes. So watch out. That zone is like the watch out zone, pre-diabetes. So be careful. So now coming to your question, why are youngsters developing diabetes? When your parents, my parents, your grandparents, my grandparents were children, there was no Coca-Cola, there was no chips, there were no chocolates. What are Coca-Cola, what are chips, what are chocolates? High sugar products, refined sugar products. Refined sugar products are refined carbohydrates. In general, Coca-Cola is nothing but liquid calorie, which is empty calories. Empty calorie ante enti? No nutritional value. It's only energy. But it has no protein, no fat, no minerals, no nutrients. Empty, liquid. Liquid calorie is empty. So what will happen? It will cause an increase in your blood sugar level. When that blood sugar increases, insulin is now released more. That insulin has to push this extra sugar somewhere. Means some tissue. Generally it is liver. How will it push? Because liver won't take sugar, no? It gets converted to fat and release. You continue eating your Coca-Cola, sugar, sweets. Sugar level increases, insulin is now increased, pushing that sugar into the cell. Finally, the cell will say, thank you, insulin, I don't want you anymore. Means insulin resistance. Insulin is resistant, it's not going to work. Diabetes. So eating high amount of sugar is definitely not good.
సినిమా చూస్తున్నప్పుడు కోక్ లేకుండా సినిమా చూస్తామా సార్? పోనీ కోక్ లేకుండా క్రికెట్ మ్యాచ్ చూడగలుగుతారా మీరు?
సో బేసిక్లీ క్రికెట్ నేను చూడనండి. మా ఇంట్లో టీవీ మొన్న కొన్నా. సో ఐ ఓన్లీ బాట్ అ టీవీ a few months ago.
You are in that 0.1% of the population.
And definitely look at me. I order Swiggy here and there. But again, see, it's not that every food is not bad. So what are the bad foods? Apart from your colas, your chips, your fried foods. And in other words, anything that is coming packaged in a plastic cover from a factory is refined. Means it is not fresh. Try to avoid that. Anything that you eat on the street, in a street vendor, that is food that is fried or cooked in an oil. Do you think he is going to change the oil in that product of cooking every time he cooks? Definitely not. పొద్దున్న నుంచి రాత్రి వరకు అదే ఆయిల్లో టాప్అప్ చేసి ఇస్తాడు. సో యు ఆర్ ఈటింగ్ ఆల్ ద ఆయిల్, ద కొలెస్ట్రాల్ దట్ ఈస్ కమింగ్ ఇన్ టు ద ఆయిల్ ఫ్రమ్ మార్నింగ్ వెన్ హీ స్టార్ట్స్ కుకింగ్, అండ్ ఇఫ్ యు ఆర్ ద లాస్ట్ గై యు ఆర్ లక్కీ ఇనఫ్ టు ఈట్ ఇట్ ఆల్. See, that's where the difference comes. Now, definitely, your mother has your health interest at heart, not that vendor, not Swiggy, not your street vendor, none of those restaurants. Your mother will definitely use oil for breakfast, throw it. Lunch, she is going to get fresh oil, throw it. Dinner, she is going to get fresh oil. Cook, throw the extra oil. None of these vendors will do it. Do you think the restaurant is going to do that? Restaurant is a business. His logic is how to save money, how to make profit.
Not your health.
At what cost? You are the cost, you are the expense. So earlier we realize and earlier we eat right is good.
అసలు నేను ప్రివెన్షన్ ఏ ఉండాలి అని అడుగుదాం అనుకున్నా, మీరే చెప్తారు ఇప్పుడు లైఫ్ స్టైల్ చేంజెస్ ఏ ఉండాలి ఇలాంటివి.
Prevention is as simple as avoiding sugar. In life, the two whites are bad, and sugar and salt. The two white powders, sugar and salt, absolutely the most dangerous, followed by oil. Third is physical activity, or what I would say, the lack of physical activity equal to physical inactivity. A person who's inactive, sitting is now called the new smoking. You're aware of that, no? So somebody who walks a minimum of 10,000 steps a day, you're considered at very little heart risk. 10,000 steps ante 1 kilometer will be 1200 steps andi for an average sized average heighted and average weighted 5'7" average heighted male in India and 76 kg male in India. 1200 steps will be 1 kilometer. 8 kilometers from the time you wake up to the time you sleep. That's all is asked. If you are not able to do that, your risk of heart disease, atherosclerotic heart disease, increases. Now they have also found one more thing. If you can climb 2 stairs fast, it's equal to 10,000 steps.
అంతేనా? 20 ఎక్కుతాయి రోజు.
So అది మనం అనుకుంటాం అండి, but climbing 2 stairs is not easy. And there's another easier way to beat 10,000 steps. It's a 30-minute interval, of which 3 minutes you walk fast, 3 minutes you walk slow. No stopping walking. Walk fast for 3 minutes, walk slow for 3 minutes. 6 minutes అయిపోయింది. Do it 5 times continuously.
అంతే.
That's all is the recommended for good cardiovascular health. But then I walk a lot. I walk almost in the morning before 6 o'clock. I finish 2 rounds of KBR Park. Then they open very early. They open at 5. By the time I start at 5:30, there must be at least 500 people in the park.
Oh my God. గొడదుకేస్తున్నారు ఇట్లా
అందరూ most likely, yes. But there are multiple entrances. And see, so the beauty of walking in a park is you're breathing good air, as opposed to when you're climbing stairs, as opposed to doing your 3-minute fast, 3-minute slow. The nature has its own perks. And also you see other people.
Motivation.
There's a motivation there. So there you breathe good oxygen, you're in nature, the environment is nice. Again, you can also do this on the pavement on a highway or pavement on your main road, but that comes at a cost of breathing more carbon. Pollution level is high.
Never know, pavements are not safe.
Yes, and you never know who's going to come and hit you from the front side or back.
We have a history.
Yes, Hyderabad definitely has a...
నాకు ఇంకొకటి అనిపించేది ఏంటంటే, సరే డయాబెటీస్ ఉంది, ఫైన్, రివర్సిబుల్ అయ్యే ఛాన్స్ ఉంటుందా?
See, diabetes is definitely, apart from being a genetic predisposition, there is a lifestyle environmental issue part also. మా ఇంట్లో ఎవరికి డయాబెటీస్ లేదు అంటే మీతో మొదలైంది. Okay. Diabetes is not generally running in the families. It means nobody is running in your family. Right? It's both ways. So we have to be careful. It does not mean that, oh, my parents don't have, so I won't get it. No, it's definitely not like that. For you, you're lucky enough that there is no genetic predisposition because your parents don't have it.
Correct.
But then if you eat a high carb diet, high sugar diet, lot of alcohol, absolutely sedentary life like sitting down from morning to night, that could be work, but a sitting job predisposes you to the risk of diabetes.
Okay.
Then your environment and what you're eating. Now you are not married or you do not know how to cook. You're constantly ordering food from outside.
Maggie.
Most of the Maggies, any of these food items, the carbohydrate level, the sugar level is high. Yeah. That increases your sugar level. When that happens and then the insulin starts to fail over time, blood sugar cannot be reduced. That's diabetes.
డాక్టర్ మీరు చెప్తుంటే అసలు నేను సిగ్గుతో చచ్చిపోవాలని నాకు ఎంత గిల్ట్ ఫీలింగ్ వస్తుంది తెలుసా?
So that's the only way you develop diabetes. And you see, contrarily, people say there's 2 types of diabetes. No, there are over 17 types of diabetes. Type 1 and type 2 are what are most common. Generally, type 1 is absolute absence of insulin. Type 2 is insulin is resistant. Means it's not able to do its job. Then there are maturity onset diabetes of the young, that itself has more than 15 types. So generally in our practice we see type 1 and type 2. How do we differentiate it? By checking insulin level. Insulin level is there but not working is one type. Insulin level is not there is one type.
Correct.
So those are the 2 basics which we see in practice. Then you also have women who develop diabetes during pregnancy. That's gestational diabetes. That has a good chance of being reversed because the pregnancy out, you are not eating as much as you were eating and your lifestyle becomes more active as opposed to physical inactiveness when you are pregnant. So that's one. Yes, by reducing if you are a normal diabetic, type 2, which is mainly because of increased sugar consumption, which eventually leads to insulin resistance. Insulin level will be the same. But the body is saying enough, you are not going to help me. There you can come down by increasing your physical activity, watching what you eat. When you say watching what you eat, you are eating lesser sugar, lesser carb. So your sugar level is, you are not putting enough sugar in your body or as much sugar as you were. So what happens with physical activity? You are consuming this sugar. It goes down further. So your insulin's resistance starts improving, so it's not as resistant, which pushes the sugar into the cell coming to a normal. So it is what you eat and your insulin, which again depends on how badly you're eating or how good you're eating now, with physical activity which makes it low. So that's the way of medically, nutritionally reversing your diabetes. You can also surgically treat diabetes by there are multiple procedures, by reducing your stomach volume, reducing your stomach size, where you're obviously not able to eat, or we make sure you're not eating as much. Then there are medications like semaglutide, which is Ribelius now.
It's on the rise. Everyone's talking about it.
And it works wonderfully. I prescribe a good amount for patients who require it. There is a criteria. It's not that you go and buy it in a shop like how the news media says. It's not as simple as that. There have to be certain things, but it is a medication. And Mounjaro and Ribelius, semaglutide, and Mounjaro is tirazepatide. These 2 medicines. Semaglutide is purely a tablet version in India. The injectable version is coming this week or next week.
Right.
Tirazepatide, which is called Mounjaro, is available only as an injectable. Both have similar ways of acting. Both help to reduce what you are eating. They increase the feeling of fullness because they keep the food in your stomach for a longer period of time, telling your brain you are full. That's principally how one of the major mechanisms, how they both of them work, apart from increasing the insulin's activity and insulin sensitivity increases. Only 2 ways. Putting food in your stomach for a longer period, telling your brain you're full. And then making insulin sensitivity more, so insulin works better.
Sir, in one word you said discipline.
Discipline.
ఇంగ్లీష్ భాషలో మాకు నచ్చని ఒకే ఒక పదం. ఇది చెప్పండి, అసలు ఈ మధ్యన ఈ హైపర్ టెన్షన్ కేసెస్ కూడా మనం చాలా వింటున్నాం. ఇన్ఫాక్ట్ దీనికి సంబంధించిన బోర్డులన్నీ టాక్స్ కూడా జరుగుతున్నాయి, ఎస్పెషలీ ఆన్ డిజిటల్ మీడియా. The causes and the effects of this?
See, basically, again, what is hypertension? Elevation of blood pressure above normal. It's not normal, it's higher than normal. So if I check somebody's blood pressure or your blood pressure now, it should be less than 120/80 to be called normal. So there is a range above which you are called hypertensive. 140/90 and above is hypertension. So 140/90 is not normal. So the range between normal and hypertension, 120/80 to 140/90, that range is called pre-hypertension. That means watch out, you are not normal, very big chance of becoming hypertension, watch your salt and watch what you are eating. So sodium is salt, or rather salt is sodium. Sodium causes elevation of the blood pressure. Sodium is essential for life and functioning. There is a range of 135 to 145 that the sodium has to be maintained. Right. Sodium going higher increases your hypertension and your blood pressure. If blood pressure goes above 140 by 90, either the 140 more or 90 more, either of them increased is hypertension.
Right.
Up to 159 by 99 is stage 1. 160 by 100 and above is stage 2. So stage 1 itself needs to be treated. Stage 2 needs to be treated even more aggressively, because the chance of you developing a heart attack, acute renal failure, strokes in the brain, transection of the aorta, retinal detachment, visual loss, it becomes very high as the blood pressure increases subsequently higher than 160. So there is a emergent need to bring it down. When you're between 120 to 140, 80 to 90, there is no urgency, but there is a necessity to bring it down. So less than 120 by 80 is where we want all of us to be.
Right.
If you are above 120 but below 140, above 80 but below 90, you're pre. Watch what you're eating. Comes back to reducing your salts.
Yes.
Exercise every day. Watch what you're eating. No smoking. If you're drinking excessive alcohol, start reducing it. Smoking, nicotinic receptor elevation of your heart rate and blood pressure. So these are the general main things. Then how do you generally identify? Most patients who generally come with a complaint of headache. Enkala head noppestundandi. That is because the blood pressure is high. Giddiness, dizziness, giddiness, feeling of the heart rate, because the pressure is high, you'll start feeling your heart rate. These are generally how they come. Then we check their blood pressure, it will be elevated. So there's now something called ambulatory blood pressure. అంటే నేను 1 hour పడుకుంటే నా బీపీ నార్మల్లే ఉంటుంది, బట్ మీరు 1 hour, 5 hours 6 hours పడుకుంటున్నారు. అదర్ 18 hours you are awake. No, other 18 hours your blood pressure is high. So first and foremost, never try to cheat yourself. If your blood pressure is high, you need medication.
Correct.
You need lifestyle changes. No, many people say, sir, నేను 1 month లో వస్తాను, నా ప్రెషర్ తగ్గిపోతుంది చూడండి అని. What are you trying to do? You are cheating yourself. ఇప్పుడు షుగర్ టెస్టింగ్లో కూడా అదే చేస్తారండి. There's something called fasting blood sugar. There's something called 3-month HbA1c blood sugar. If they know tomorrow is their blood sample testing in the morning, ఈరోజు లంచ్ తినరు, ఆర్ స్మాల్ లంచ్, డిన్నర్ అస్సలు తినరు, మార్నింగ్ ఫాస్టింగ్ షుగర్ చేస్తారు, అది 100 ఉంటుంది, చూసారా నాది 100 ఉంది, ఎంత బాగా కంట్రోల్ చేసుకున్నాను. But 3 months sugar will be somewhere sky high, because you can't fast for 3 months. It's not possible. So what are you doing? You're cheating yourself. When you do that and come with test to your doctor, the doctor sees that 100. He's not going to ask you, మీరు lunch తినలేదు కదా, మీరు dinner తినలేదు కదా. But don't think the doctor doesn't know. He knows, because your 3 months sugar are sky high. But you have smartly cheated the test and cheated yourself.
Not the doctor.
Not the doctor. See, నా కాలు మీద కాలేసుకునే నేను కూర్చుంటానండి. ప్రాబ్లం వచ్చేది పేషెంట్కి. దే హ్యావ్ టు రియలైజ్ వాట్ దే ఆర్ డూయింగ్. డోంట్ ఎవర్ చీట్ ద టెస్ట్ ఫార్ జస్ట్ సీయింగ్, ఓహ్ mine is 100. But again, till the next test is done, you know what you did. Don't do that. See, what happens now is I might not increase your medication. You might actually want more medication. But looking at that 100, I will not increase it.
Correct.
So now, apart from that 100, your blood sugars are already 250. Whole month, that 250 is ruining your body. So don't cheat yourself in tests like that. సార్ డాక్టర్ గారు, ఇప్పుడు మీ దగ్గరికి రాగానే నా బీపీ పెరిగిపోతుందండి, ఇంట్లో రోజు చూస్తాను సార్, రోజు 100 కూడా ఉండదు.
పెరుగుతుందండి.
ఎగ్జాక్ట్లీ. ఇప్పుడు దెర్ ఇస్ సంథింగ్ కాల్డ్ వైట్ కోట్ హైపర్ టెన్షన్. అంటే డెఫినెట్లీ నాకు ఏదైనా ప్రాబ్లం ఉందని చెప్తారేమో అని ఆ బ్లడ్ ప్రెషర్ పెరుగుతుంది. Very few people, maybe single digit percentage, might have what is called white coat. Doctor nakedo undan cheptadu emundo. That is white coat hypertension. But that is not for everybody. There are genuine people who are normal. ఏదో నాకు డాక్టర్ గారు ఏదైనా ఉందని చెప్తారేమో, దట్ యాంగ్జైటీ ఇంక్రీజెస్ దేర్ బ్లడ్ ప్రెషర్. దట్ ఈస్ కాల్డ్ వైట్ కోట్ బికాస్ డాక్టర్ వేర్స్ అ వైట్ కోట్. నో, ఇట్స్ కాల్డ్ వైట్ కోట్ హైపర్ టెన్షన్. దెర్ ఇస్ అన్ ఎంటిటీ లైక్ దట్. బట్ అగైన్, డోంట్ చీట్ యువర్ సెల్ఫ్ బై సేయింగ్ ఐ చెక్ మై బ్లడ్ ప్రెషర్ ఎవ్రీ డే సార్, మార్నింగ్ అండ్ ఈవినింగ్ ఎప్పుడు నార్మల్ ఉంటుంది. మీ దగ్గరకు వచ్చినప్పుడే 180 చూపిస్తుంది. ఇట్స్ లైక్ దట్ షుగర్ గై, రైట్? యు ఆర్ చీటింగ్ యువర్ సెల్ఫ్. Now what do I believe? Do I believe my machine or believe him and his wife, or the wife and the husband telling me kaadu maadi intlo normal e untadi? So these are certain things that happen in our scenario, that how do you go about this, right? Do I believe that reading that my nurse took which is showing high, or do I believe the husband and wife couple who say every day I check?
Clearly, what you have in front of you is the number.
I have to go by that.
Oh.
If you're diabetic, you have identified these issues have not developed, you start eating well, healthy lifestyle, control it properly, medication is used properly, you are making an effort, it will not kill you.
So basically, lifestyle set చేసుకుంటే ఏ గౌరవ ఉండదు. Lifestyle includes food, sleep, and exercise. Got it, doctor. Like I said, ఇది నేను అడిగే కొద్దీ ఇది ఎండ్లెస్గా వెళ్ళేటట్టుంది కాబట్టి ఒక్కసారి నేను బ్రేక్ వేసి ఐ జస్ట్ టర్న్ ద టైడ్. నౌ ఐ హ్యావ్ అ రౌండ్, ఇట్స్ కాల్డ్ ర్యాపిడ్ కేర్ రౌండ్. యూ హ్యావ్ టు ఆన్సర్ ఇన్ అ వర్డ్ ఆర్ అ సెంటెన్స్ ఇఫ్ యూ క్యాన్. లెట్స్ గో. Intermittent fasting, fad or fact?
Fact.
Do you do it?
No, I hardly eat very small meals any which way.
Okay. Keto diet?
I am against keto diet.
Sustainable long term?
No.
Okay. Sugar substitutes, are they healthier?
No.
Sleep, ideal duration for optimal health?
8 hours.
8 hours. Supplements, necessary or overhyped?
Overhyped.
Stress management, me quick tip?
Switch off your phone. Or don't listen to your wife, maybe.
1 hour flight lo phone switch off untene
that you're welcome to use, Andy. That will not affect you because in other words, you're killing time there. Now, if you don't use your phone in a flight, what are you going to do? You don't know the person sitting next to you. So that you can always download a video and watch a video or listen to some downloaded music. Obviously, there's no internet on a flight.
Vaccinations, importance for adults?
Absolutely. If there is a vaccine available, you should take it.
Hydration, how much water is enough daily?
It depends on your body size, and about 4 liters for a 76 kg male or female.
Plant-based diets, benefits and challenges?
Yes, plant-based diets and plant-based protein have shown in multiple studies. See, protein as a food product is a difficult to digest food. Of that, animal-based protein, your whey protein, are even more difficult to digest. So, yes, plant-based protein.
Finally, probiotics, what the hype?
No, probiotics are absolutely worth it because I'll put it this way. Your most important organ in your body is your mind.
Okay.
Your second most is when you say I have a gut feeling, is your gut, because the gut also has neurons.
Right.
So that is why you say gut feeling. So the second most is the gut.
How do you start and end your day?
I wake up at 4:45 without an alarm. I go to KBR by 5:15. I do 2 rounds of KBR. I come back from KBR by about 6:45 home. I live in Banjara Hills, so it's very close by. My breakfast is about 5 egg whites, no yellow, a portion of vegetables, boiled vegetables, and a small portion of fruit. With I generally have about 2 cups of an espresso before I start at 5 a.m. There's a machine, you press that espresso comes, the podded machine. Come back, have a nice big cup of coffee at home with breakfast. Then I'm in the hospital by about 9 o'clock. Then I finish at 4. 4 tarvata I have my office Sunday. So the certain other businesses that I run. So I'm back by 6. I'm in bed by 8:30, and I haven't seen 9 o'clock in many a times, except Saturday. When Saturday I feel is my day off from work, from hospital, from patients, because that 2-3 hours that you spend with your friends on Saturday, it's like you're a little boy. So you have fun, you have a good time, you switch off, and you don't have any responsibility for those 3 hours. That's the way I look at it.
సార్ మీతో ఫ్రెండ్షిప్ చేయాలంటే ప్రాసెస్ ఏంటి సార్?
ఫోన్ నంబర్ ఉందిగా, ఫోన్ చేయొచ్చు.
ఓ మై గాడ్, మీ లైఫ్ స్టైల్ అయ్యో అంటే మిస్టర్ ఇండియా, మిస్టర్ యూనివర్స్?
No, I'm a 43-year-old man now with one wife and 1 kid.
Clearly you are inspiring. I don't know the family though. Clearly inspiring half the world. Thank you so much, doctor.
Thank you.
I had a great time.
Thanks
I will
a lot.
definitely apply for your friend's post.
Thank you.
Thank you so much.